Welcome, I'm Enrico Maraskin. I'm a pediatrician practicing in Morningside in South Africa. This is my passion, little children. I love seeing children in their natural setting, learning, discovering, going to school, playing sport and staying happy. Here we have the vaccine schedule that is produced by the Pediatric Management Group of South Africa, and we can see from the schedule, very busy slide, and by the time the child gets to 12 years of age, we see that there are lots of injections and lots of holes in this poor child's skin. However, on the left-hand column, we have a long list of illnesses which we're going to consider today. Pertussis, otherwise known to the layperson as whooping cough. This is a very hard 6-week illness, starting with sneezing and a low-grade fever, progressing into a severe coughing spasm. Immunization is the best protection, and where there's an interruption of immunization, we see immediate outbreaks. So just this week, I've admitted a child who, despite having received the first vaccination against whooping cough, did not have enough immunity and was admitted to hospital with severe coughing spasms, and these are very hard to cope with. So a baby will come into your rooms and the child may even look totally well, and the mother gives you the history of a severe cough, and once that child starts coughing, then you understand what's going on. The child will cough and cough and cough, and it seems like the child will never stop coughing. However, at the end of the cough, the child will make the classic noise where the disease gets its name from, which is a whoop, and it sounds like a whoop. In our pictures, we have a child on the top picture who is coughing severely in such a manner, and the one doesn't really want to experience that. It's really not a pleasant cough to experience. So the severe pressures generated by this cough then can result in pressures in the blood vessels, and in the bottom picture we can see a child who has bled into the sclera of the eye, as seen in the red regions around the center of the eye. And this pressure can also result in bleeds into the brain, which ultimately can be severe and even life-threatening. A lot of the hype around the whooping cough vaccine came when there was vaccine denialism in the UK, and people didn't want to vaccinate their children anymore. Maybe one of the reasons being that they don't see these illnesses anymore, and there was an immediate outbreak of whooping cough with dire consequences to people who had to suffer this illness.
So, having considered the facts pro and con vaccination, what is your decision? I came across this site on the internet. I consent to being forcibly restrained and injected with multiple viral strains, preservatives and heavy metal adjuvants. Said no baby ever. Having looked at all the facts in our talk, you can see that the effects or side effects of the vaccine are very small if one compares it to the devastating effects of the illnesses that we deal with. If we have a look at the right-hand slide, we have a child who's fully immunized and protected against these life-changing illnesses. In my opinion, if I had to choose, I would choose to vaccinate my children fully, with the knowledge that we are placing these children at risk if we don't vaccinate.
So thank you for joining me, Enrico Maraskin, in this discussion. I hope I've shown you the reason for my passion for controlling the disease processes that we vaccinate against. And I hope it'll give you some insight into making your own decision of whether to vaccinate or not vaccinate.